Good morning, everybody. My name's Aditya. I'm one of the founders and CTO at Luma Health, and welcome to today's episode of Digital Health on Air. I'm joined today by Frances, or as she goes by Fran Pom, who is the president and CEO of Zufall Health, which is a FQHC, a federally qualified healthcare center in New Jersey. Fran, welcome to the show.
Thank you. Thanks for having me.
I'm really excited to spend this episode, this edition today of Digital Health on Air, talking to you a little bit about the work you've done at Zufall, kind of your story, a little bit more about Zufall itself. But let's start with maybe a little bit of your story. You started, I think, as the executive director of the women's care program at Zufall, and you've kind of grown from there into various roles, now culminating with running the show.
Yeah, actually, Women's Health and Counseling Center was a separate agency, but I was looking around and seeing how we could improve our financial situation, and it seems that the FQHCs had a little bit of a better deal. So I reached out to Zufall Health, and we actually joined Zufall Health in 2014. The organization was growing, and so my predecessor, Eva Turbiner, she created the COO position so that I could stay on board. And it's been a wild ride since then.
So tell me a little bit. Joined like officially 2014. I think you became CEO in 23, or was it 22?
23, the beginning of
23.
23.
So that's a bit like 9 years. You saw a lot of change between there. Like, what's like, in your words, what's different from the day you left to the day you took the new job?
So we've grown a whole lot. When Zufall Health started, right, it was a volunteer effort. Dr. Zufall and his wife said, "Hey," they actually started to volunteer in South America,
Oh, no
and
way. Okay. I don't
they
know either.
said, "Well, gee, that's kind of far away, and there's people right in our neighborhood that in our area that need help too." And so they volunteered, a night a week, started out. He was a urologist, but he
Hmm.
brushed up on primary care, and they began offering to see patients. And they started out with a local agency, then they moved to a church, then eventually formalized and had their own space. Um, but the reality is that what's our mission? Our mission is to serve people in need, and it seems that everywhere we look, there are people who struggle to have quality and equitable access to health services. So we began simply growing as much as there's been an opportunity to sustain ourselves financially as well as grow. So when I joined the organization, I think there was only um, three sites, maybe four, a mobile unit, and now we have 12 licensed sites, including those two mobile
And just
units.
for our audience's benefit, where in New Jersey is your kind of service area?
So Dover is our hometown. We are in smack dab in the central of northern New Jersey. And then we are operating in 7 counties all around there, north, central, west. There isn't a name exactly.
It's funny. My folks live in Jersey. They moved there about 15 years ago, and they're like, "Where do you live?" And the running gag is like, "Where what turnpike exit do you live off of, or whatever it is?" But like, I found that actually it doesn't actually describe how to navigate New Jersey at all. Like they're like, "Oh, it's like north central, but you go a little bit to the west, and you go over that river." Like, okay, I have no idea where that is, but so
Yeah,
13.
right.
Where's the newest location of the 13?
So it's not really a new location, but we built our first ever brand new building in West Orange, which is Essex County. So moving a little further east. That's not, but technically it was already licensed. We had another site there.
Sure.
We had a small rental, and now it's a large building. Um, but our technical newest is our school-based health center. We have
Oh,
our
that's
first
awesome.
ever school-based health center in southern Somerset County,
Hmm.
Franklin Township. It's actually still not with a building yet either. We're working with our mobile and sometimes in the school building, and it's a wonderful partnership with the school and the municipality. With some of their American Rescue Plan funds, they're actually building us a building on the campus of one of their middle schools
Oh,
so that we can
wow.
both serve the school district as well as be open to the community.
That's
So
amazing.
within a year, we'll have a new building there too.
So, I mean, I think one of the, you guys have grown so much, and I think there's, I think I have in my notes somewhere that you have a new you've launched a trauma informed care like practice and trauma informed care delivery model, which I think is something that happened like that you spearheaded. I'd love to hear like that sounds like, for FQs, it sounds very innovative because you guys are doing things around like reaching into like the school-based communities, like reaching into like people, I think you have a dental unit as well. Like there's a lot of different services, but I think the trauma one is something, if memory serves, that you're exceptionally proud of. And I'd love to hear just a little bit more about the story that launched that. And, I think the question that all the viewers are going to have is like, you're growing when FQs are kind of shrinking at the moment. I would love to hear kind of, lead into that at some point. We'll get there because everyone's going to be curious, but would love to hear more about the trauma practices first.
So I think the idea or the information initially was spearheaded by our chief medical officer, Dr. Rena Ramirez. She's really remarkable and always looking to learn everything that we can learn, try new things. And in the heart of trauma informed care, which we've been doing for a couple of years now, it's really some of it translates into just really great customer service,
Sure. Yeah.
because
Yeah.
it's really taking into account the patient's experience, right? And understanding that why they react to things or don't react to things has all to do with them and their life experiences and less to do with us, right? So it helps the staff be more understanding of their experiences. There's a lot of research over, you've probably heard of ACEs, adverse childhood
Sure.
experiences,
Yeah.
and how those uh, trauma experiences um, actually have a harmful effect on your health long term if they're not addressed and recognized. And
Sure.
so
Yep.
part of the
Totally.
concept is that all of us come with our own life experience that influence how we interact with the world around us,
Yeah.
and we need to give people choices. We need to, listen. We need and this applies also to how we treat each other in the workforce. And so this is also a retention effort too, to have people feel seen, heard, and we try to teach all of our employees assume best intentions instead of just getting pissed off when your colleague does something you didn't like, to stop and think, I think they probably meant well,
They
even
weren't,
if
yeah, they weren't trying to sabotage me. They have a lived experience behind them too.
yes, exactly.
Yeah.
So we try to it's more of an ongoing thing, is try to embed those philosophies and some of those principles in everything we do.
Yeah, I mean, I think there was a trend I remember, it maybe like 10 years ago, kind of in the FQ and FQ broader space, which is FQs are adding a lot of behavioral health services, and behavioral health in general is it's a growing segment of kind of care delivery. But it was really kind of it was indexed along the model of like the whole person care, right? Which is, it's not just, your medical conditions, but it's the entire, SDOH that surrounds it. It's the entire lived experiences that come around it. Do you find that trend continuing, FQs delivering more behavioral, more whole person, or, is that kind of like we're hitting a peak there? Where do you see that evolving?
No, I think it's only expanding. In fact, right now, HRSA has a grant opportunity out for behavioral health expansion.
Mm,
And there's been an increased emphasis. All of the school-based opportunities have had a requirement for mental health services as part of that. The pandemic and post-pandemic, a lot of emphasis on adolescent health, and how all of us are still, there's still effects of this,
yeah,
global
sure.
experience that changed the way we did and thought about just about everything. So I think there's more. A lot of FQHCs struggle to provide a lot of behavioral health because
Yeah.
it wasn't always reimbursed. There's been a lot of recent changes that have helped, expanding, and some of this is state by state, though, expanding who will be reimbursed, what kind of providers, right? There's all different
Like what
kinds.
license levels and that sort of stuff.
Exactly.
Yeah. Yeah.
And so that the challenge is that there's, not enough. There's not enough. In particular, we're always looking for bilingual
Hmm.
providers. Um, so expanding the kinds of providers we can use has been really helpful. But there's still work to be done to increase the pipeline, right? We need more people who are interested in going into the field.
Yeah. And then when you find kind of the license types in the state, do you find that like New Jersey as a state is like leading the way? Like where are the examples that you see, like, because you're saying it very state by state. I'm curious because the
Yeah.
audience will be
Well, that's one of the
nationwide.
things that recently happened in New Jersey, that they expanded that we could get reimbursed from licensed clinical social workers were always like acceptable, but then
Yes.
there's licensed professional counselors and licensed marriage and family therapists, and there's a whole variety of them.
Totally.
And so that has recently expanded in New Jersey, and important because 50% of our patients, and we're a little bit of an outlier, remain uninsured.
Sure.
So, despite the expansion of Medicaid, despite the expansion last year, Governor Murphy expanded Medicaid to all children, regardless of immigration status. Um, we still have a persistent group of people who aren't eligible.
Ugh.
And so charity care a few years ago, New Jersey fortunately has a charity care program, so we can get at least a little
Yeah, I
reimbursement.
guess
We'd like it
something.
to be
Yeah.
bigger, but we're advocating for more. But at least we get something. And they also began to reimburse for behavioral health services,
Right.
which has enabled us to expand a little bit more.
That's really interesting because I mean, maybe this is a good way to segue and transition into the conversation around like funding because we've heard from a lot of our FQ partners across the United States, like Luma partners with probably about 100, 120 FQs, that funding like the spigot of money from COVID is drying up, and services we're going to have to cut or reevaluate where we're delivering care. If it's mostly primary, do we going to refocus on behavioral? We may have had like an OB clinic we're shutting down or that sort of stuff. So you managed to continue to navigate those waters. I'm really curious to see, like, you mentioned your HRSA funding, like, it seems like you have a very close finger on the pulse of how the funding story is changing.
So we all knew that the COVID funding
Yeah, the
was
good
going
times
to
are the
end.
good times, I should
The
say,
good
we're going
times.
to last
Yeah,
forever. Sure.
it was an unusual convergence of activities, right? Like we were crushed with all these new things we had to do because of COVID, and then extra money started to flow sort of a little bit after that. And so it allowed you to do some new things. So I imagine some people said, "Hey, we have enough money to let's use Luma." No, we were ahead of the curve. We
You're
were
way
for
ahead of the
that.
curve.
Um, but there's the stall in Congress, right, where they can't in a timely way approve a federal
Yeah,
budget.
appropriations happen. Yeah,
Yeah,
totally.
it's really going to harm things because already. So, for example, HRSA put out a new access point opportunity, but it's with the caveat of funding a federal budget in 2025. And so you're going to put in
Kind
an
of a weird
application.
way for a federal agency to behave, right? It's like, we're going to do these things. Big star on it saying maybe.
Exactly. And, strangely enough, they initially said they weren't going to do that, and then they changed their mind. So I don't know. I'm not sure what happened, but um, so I think that the opportunities are going to be more competitive. It's not that there won't be any opportunities, but they're going to be extremely competitive. They're giving out something like, if they get the money, 77 new access point, and you get extra points if you're a lookalike.
Mm.
And there's like 170 lookalikes in the country. So,
Yeah, this is going to the peanut
and
butter
there
is going to
hasn't
spread
there
pretty
hasn't
thin.
been an opportunity for a new access point grant in, I don't know, maybe since 2019. I don't remember exactly when. So I think the opportunities are going to be more narrow, and more competitive.
Yeah, I mean, it seems to be, and then there's what you're saying around the charity care model, for the 50% of your patients who still are unable to qualify for state sponsored or government sponsored care insurance program. Do you find that like end dollar reimbursement from patients is always going to be a challenge in the SQ model, right? It's just been that's the service model that exists. Do you find that like that is changing at all? Like it sounds like New Jersey is taking positive steps in that direction. Like you said, I'd love a little bit more, but like one is better than zero. Do you find that like that may become a better's not the right word, but an alternative way that your kind of revenue stream evolves over time?
So getting reimbursement from patient services is the biggest pie. That's the biggest part
Yeah.
of the pie, right? And so that's always remains important. So, um, that we have to be ever more careful about doing things well so that we collect all the money that we're owed. And even from patients, right? We have to offer the sliding fee scale. But I tell
Yep.
all employees when in orientation that if the patient pays, it seems like nothing, $20 is our nominal fee. $20 times,
Yeah, it
hundreds of
adds
thousands
up.
of
Yeah.
visits adds up.
Yeah,
And
yeah,
so,
absolutely.
collect those if you can. Obviously, we never deny anyone care for inability to pay, but still, the patient's contribution matters. The federal portion of our budget is only about 17%.
Oh, okay.
So it's a smaller piece. It's important, but a smaller piece. But we do a whole lot of fundraising on our own from state and private sources,
And I believe you have
individual.
your foundation now as well.
Yes, we set up a foundation to try to, give a little gusto to our fundraising efforts. And so, for example, last year we set out to replace our aging mobile medical van. So over the course of the year, through a combination of efforts, special event, etc., we raised about $450,000 so that we could purchase a new vehicle. So, we're not waiting around for
Yeah, I mean,
it
that's
all
a
to come from
great
HRSA.
example of like you're taking, matters into your own hands, right? And I think that's part of the stuff that I think really working with you over the last couple of years, like your leadership, I think really exemplifies like we will be at the front of the pile. We will be the tip of the spear to go
We do
figure
employ a lot of like A students. They,
out. It's
they
all
don't,
type A people, ambitious, ready to get stuff done. I
yeah,
love it.
pretty much.
Um, in one conversation that I think we should also have, because it's in the world of funding, it's kind of more about like care deliveries. It's funny, value-based care is coming, but I've been saying that for 9 years, 10 years, 12 years, whatever it is. But you definitely start to have these conversations much more, I would want to say, in the last 18 months, where it feels like maybe the domino is tipped. And I'm curious from your seat, both in terms of payer mix and like patients who present and like, all that sort of stuff. For certain care conditions, do you actually find that it's having a relevant impact on like how you manage care yet?
So there hasn't been value-based payment really in New Jersey at all. The closest you can come to it is some of the quality programs through the MCOs, the Medicaid, managed care organizations,
Yeah.
that are giving you bonus for quality
Right.
essentially. So that's the closest you come
Yeah,
to
and that's
it.
been like more indexed against like care delivery quality necessarily than like, bundle payments and the sort of stuff you expect, right?
Exactly. So we have joined the Making Care Primary Initiative through CMS,
Mhm.
which is a 10-year pilot. So it's hard to
It's
sign
hard
up
to say
something that's
10
for
years as a
10
pilot, right? At some point, it's just
Yes.
reality, right? But
Yeah. So 10 years, they're only working with 8 states to sort of, they've got 3 tracks to help you prepare essentially. And, we decided to put the hat in the ring because, well, if this is where things are going, wouldn't I rather have a say in
yes.
how it goes than just wait and see what happens? So it's just beginning now, and so the 3 tracks are something like the first year it's really just about preparation, making sure that you have the IT infrastructure that you need, your systems in place, and then it starts to gently shift in the middle phase where you're getting less fee for service and a little bit more of
Like
the
a little
bundled.
sprinkle of value-based bundle. Yeah.
Yes. And then in the third, it really flips the other way, where but this is only Medicare,
Mm-hmm.
and Medicare is the very smallest slice of
Off
our
the pie.
patient base.
Yeah.
So it's going to affect, I mean, you had to have something like a minimum of 500 patients on Medicare. And so it's like an experiment with a very small slice
Yeah, like
of
the N, so to speak, is very tiny. But I think this, if anything, what this entire conversation has really illustrated for me is how much you're thinking about all the different places in which like Zufall Health can play, both from like like using your own words, like I want to have a say in like how that program develops. It may take 10 years, but at least we'll have had an opportunity to influence that. You're looking at state funding opportunities, you're fundraising yourselves for the mobile van, like that takes a lot of leadership. And how do you just honestly, just as a leader, keep all these balls in the air, like outside of actually, running your health system?
It comes down to your strategic plan, right?
Yeah.
First, and where do you see yourself going? And in fact, this is now many years ago, but when I first joined Zufall, there was a lot of moaning and groaning amongst the staff about how much we were growing, right? Because it was like extra work, extra work, extra work. And through one of our strategic planning processes, I said, we have to change the way we look at this, as this is not like just accidental. This is intentional. We are
We didn't trip into a new building, right?
we are purposefully seeking growth because it fits our mission, and we think it
Yes.
strengthens the organization overall to be able to, provide more services and, lean on the systems that we already have. And so, first of all, that's where it is like mindset and making sure that your board and your senior leaders and really the whole organization understands that we intend this. We are going to grow. We are an organization
We want to service
seeking
these
to
communities
do more.
deeper, better,
Exactly.
more services. Yeah.
Because there is a little bit of a sentiment like, oh, we're not ready. Oh, like we're still, things aren't working. We still have things that aren't working well. Nothing's ever going to be
Yeah.
like
Yeah.
perfectly organized. Things are always in a state of change. And, getting people to embrace that a little bit is hard.
Yep.
Most people have struggled with adapting to change. So we accept that that's hard, but we also push people to say, but this is how why we're here,
Yes.
and this is
This is the mission we signed up for, right? It's delivering
exactly
services. I
right.
mean, I think that's fantastic. And I like to say a lot to folks here at Luma. It's like, we're going to get some things wrong, but we're going to get more right than we get wrong. So that means there's an opportunity to get wrong so that we can get the bigger stuff right. And, it's part of it is that like learning about like, how do we service our customers? How do we service our patients? How do you service your communities better? And part of that is our growth. It's like, we want to, our missions are not somewhat, but they're quite aligned. It's like, how do we service more patients? We have this goal here at Luma. It's like, we want to serve 1 out of every 5 patients in the United States. And every year that goes 1 out of 5, 1 out of 4, 1 out of 3. The goal is always to service every patient. But, with partners like you, we're helping ourselves and we're helping those patients get there. And, I think, Fran, really, this conversation is really, for me, illustrates what an incredible leader you are and like the incredible work you've done at Zufall, to really come and build like a leading institution that, takes care of its community, that, goes into new schools, not just for the students, but also, the community that school is within. I think that really shows, in a constrained funding environment, like how you can continue to grow and, like I said, how you can continue to serve.
I think, I'll say in the last few years, all of the growth that we've done has been in partnerships with others. So
Mm,
that would be another thing I would say is critical. You've got to take advantage of what else is going on with others. So we've opened something with a mental health agency, the school-based, with in partnership with the hospital. Like we've done a lot of, your opportunities come in different forms, and you just have to
yeah,
be
I mean,
open.
healthcare is not an island, right?
No,
It's,
at all, not at all. And if anything, that's sort of my goal is to increase the breadth and depth of our partnerships.
Yeah. And I think that makes sense because that builds longevity along the way, right? So, Fran, I know I've taken up a good chunk of your morning. You've been very generous with us today. What you shared is so informative, so articulate, so well stated. And honestly, it's very refreshing, to hear someone in the FQ space with such a clear vision on how can we do more? How can we service our patients better? And that's ultimately what we're here for at Luma too, is just like, how do we just provide better service and care to patients? And, we thank you for your years of partnership. And I think, the audience here at Digital Health on Air is going to be very appreciative of the incredible work you do in the New Jersey communities.
Thank you so much. And looking to do things more efficiently is is why we partner with Luma. So we keep trying to make everyone remember all of the features that are available to us that we don't always take advantage of.
We love that. And we love the partnership too. And I'm looking forward to coming out to Jersey soon and seeing you all again very
Excellent.
shortly. All right.
Excellent. We'd love to
Thanks,
see
everyone.
you.
Appreciate everyone joining on Digital Health on Air. We'll see you on the next episode very soon.
Thank you. Bye bye.